Mogamulizumab is a humanized antibody that targets chemokine receptor 4. And chemokine receptor 4 is responsible for T-cell recognition of the immune response. And we don't know its specific action in T-cell malignancies, but we think there's an on-target effect. So a number of T-cells express CCR4, and when mogamulizumab targets it, it is missing a fucose on its FC region, the constant region in the antibody, and that allows for enhanced antibody-dependent cellular cytotoxicity. So there's a direct on-target effect. But then CCR4 is also present on normal T helper cells, T helper 2 cells, T regulatory cells, and we're investigating this. In fact, here at ASCO, there have been a number of abstracts looking at mogamulizumab in solid tumors that don't perhaps express CCR4, and there's probably a role in immunotherapy for its mechanism. So I research a rare disease called adult T-cell leukemia-lymphoma. Here in the States, there are probably only 150 new cases diagnosed each year. It has a terrible prognosis. On average, patients survive about a year, and we don't have standard treatment options in this country. So mogamulizumab is an antibody that's proven effective for this disease in Japan. And my colleagues and I wanted to test if it was effective in populations outside of Japan. So working with 22 other sites at centers around the world, not only in the US, but the UK, France, Brazil, Martinique. We enrolled 71 patients and we randomized them to receive this mogamulizumab or what their treating physician thought would be appropriate chemotherapy for them. And the results showed that the mogamulizumab produced a response in about a third of patients, whereas the chemotherapy option had limited, almost zero response rate. So this is very promising for patients with ATL who previously had no available treatment options, and we're hoping that as we continue to study the data, this will help them live longer. So mogamulizumab has been approved in Japan since 2012. It's not approved elsewhere, and that was part of the reason for doing this registration study. The sponsor is in discussions with the FDA, and we look forward to hopefully promising news soon. So the take-home message from this study is that there's a new immunotherapy, mogamulizumab, which is more effective than currently available chemotherapy for patients with a rare, deadly blood cancer. And previously they had no or limited treatment options. So this is exciting for ATL patients.